And then I said, supposing you brought the light inside the body, which you can do, either through the skin or in some other way.
To thank the President, thank the Vice President for their ongoing support and leadership to the Department and for their work in addressing this pandemic. I would also like to thank the scientists, not only in S&T and the NBAC, but to the larger scientific and R&D community. Thank you very much.
Brian. Mr. Brian.
Thank you very much. So I asked Bill a question that probably some of you are thinking of if you're totally into that world, which I find to be very interesting. So supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that has him in check, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do, either through the skin or in some other way.
What you talking about, mister?
And I think you said you're going to test that, too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that?
What you talking about, Mr. D?
By injection inside or almost a cleaning, because you see it gets on the lungs and it does a tremendous number in the lungs, so it'd be interesting to check that.
Hold it. What you talking about?
So that you're going to have to use medical doctors with, but it sounds interesting to me. So we'll see, but the whole concept of the light, the way it kills it in 1 minute, that's pretty powerful.
What you doing?
I'm just hearing this, not really for the first time. I mean, there's been a rumor that, you know, a very nice rumor that you go outside in the sun or you have heat and it does have an effect on other viruses. But now we get it from one of the great laboratories of the world, I have to say. Covers a lot more territory than just this. I would like you to speak to the medical doctors to see if there's any way that you can apply light and heat to cure.
What you talking about, Mr. D?
You know, that if you could. And maybe you can, maybe you can't. Again, I say maybe you can, maybe you can't. I'm not a doctor. But I'm like a person that has a good, you know what.
What you talking about, Mr. D?
Sir, you're the president.
Deborah, have you ever heard of that? The heat and the light relative to certain viruses, yes, but relative to this virus?
Not as a treatment. I mean, certainly fever
Yeah.
is a good thing when you have a fever. It helps your body respond. But not as, I've not seen heat or light.
I think it's a great thing to look at. I mean, you know, okay?